I see something as being very important is the area of trust and security, because we are talking about health. We're in a very dynamic digital area, and we're very happy to try to foster that dynamism in this part of the economy and the public sector. But people want to be sure that what they're using is working, and they also want to be sure in many cases that their privacy is protected. So in following up on this mHealth Green Paper, our policy document, we launched a code of conduct with the industry in collaboration on mHealth app privacy, where the industry says, the app developers say, what they are promising to the citizen, to the consumer, in terms of protecting their privacy and meeting their expectations. This was submitted to the member states of the EU, the Article 29 Working Party, last week for review, so that work has basically been finished. And then we're also working on guidelines on quality and reliability of mHealth app data, and have launched a public consultation of the safety of apps and non-embedded software to ask people if there have been problems in this area as part of an evidence gathering exercise. In this country, there is the publicly available Standard 277 of the British Standardizations Institute on mHealth apps, which actually has been submitted at the European level for review and discussion. So it might be, Europeanized or modified perhaps a bit, and then adopted on a European level. But this is work right now in our standardization work plan. Then you have these guidelines on the reliability and quality coming up, which are aiming specifically at linking the mHealth apps data to the healthcare system, to healthcare records, obviously by those who are the holders and the managers of those records. It's not our decision. And those, I think, are the main guidance out there. We're trying very much not to create bureaucracy or any kind of over-regulation. Again, we want to leave this as an area for experimentation, for people to try things out, though obviously if it is something quite serious in the area of health, then for instance it might be a medical device, and then there's binding legislation on those kinds of apps that are doing diagnosis, for instance. But then for the other areas, to have freedom, but as much assurance as possible. The Code of Conduct on Privacy, as I say, this is a little bit what the app developers are promising to the citizens. So this is really not doing anything with their data that they wouldn't approve of. And this doesn't mean going back to them every week, but really setting out to them in the beginning the way that their data is going to be managed, and only making some radical change with their consent. The other guidelines on the quality and the reliability, as I said, the idea is to enable those healthcare systems that do want to utilize the data in the apps, for instance, to see how active a person is being or how they're changing their eating habits, to see which apps are giving accurate data. This obviously is also something that's useful for the app developer or the patient's organization or the medical professional who may want to evaluate, I want to see which apps I might encourage my patients, or sell to the public sector or sell to the consumer market, which attributes they should have. So ideally it will fulfill a multifaceted role. You have this aforementioned code of conduct, which actually sets out an example that can be utilized by app developers. But more broadly, this is in legislation in the member states in the UK, and where we are right now, and also in the European legislation, that there should be sufficient information. It should be understandable. This, massive, many pages and just tick the box is probably not best practice, and the person should understand it and should know what they're signing up to. So the kind of so-called boilerplate in lawyers' lingo that is basically overwhelming someone with details, and they're not noticing what is in the text somewhere in the 30th page is not the best practice. It should be comprehensible. It should tell them either we are going to, pass the data to your doctor, to your hospital, or, for instance, others for research, others for public health issues, and so that the person understands. We do know very much from empirical data that citizens in the whole, in a very high percentage, support biomedical research, support public health monitoring, and it's just a question of them understanding what they're doing and how they're collaborating with their data.